It's easy to shrug off certain symptoms. After all, life gets busy, and we don't always have time to worry about every little thing. But when it comes to cancer, ignoring even the smallest signs could have serious consequences. In this video, we'll explore 9 alarming cancer signs women often ignore. These symptoms might seem harmless at first, but recognizing them early could be the key to getting the right treatment when it matters most. Stick with us to learn how to spot these warning signs before it's too late. Our countdown begins with a paradox. What if shedding those extra pounds wasn't a reason to celebrate, but a warning sign instead? At number 9 we have unexplained weight loss. Unexplained weight loss could be your body's way of waving a red flag. While many women might welcome dropping a few sizes without effort, it's crucial to understand that losing pounds without trying can be an early warning sign of serious health issues, particularly certain types of cancer. The American Cancer Society emphasizes that weight loss without trying can be indicative of underlying health problems, including various types of cancer. This unexpected weight loss is often linked to cancers of the esophagus, stomach, or lung. But why does this happen? These cancers can interfere with your body's ability to absorb nutrients properly, leading to unintentional weight loss. It's also worth noting that unexplained weight loss isn't exclusive to these cancers. It can be linked to other types as well, such as pancreatic, liver, and colon cancers. This doesn't mean every instance of weight loss is cause for alarm, but it's important to recognize when it might be more than just good luck with your metabolism. So when should weight loss be a cause for concern? If you've lost 10 pounds or more over a few months without trying, it's time to talk to your doctor. They can help determine if there's an underlying cause that needs attention. Your body is complex, and it has ways of telling you when something isn't right. As we move down our list of often ignored cancer signs, could your daily routine hold clues to your health that you've been flushing away? Number 8 on our countdown is changes in your bowel habits. It's not a topic most people like to discuss, but it's crucial for your health. Your body has ways of telling you when something's not right, and sometimes that message comes through your bathroom routine. What should you look out for? If you notice ongoing changes in your bowel movements, like having diarrhea or constipation that doesn't go away, then this could point to a health problem. These changes could be signs of colorectal cancer. It's especially important to note if your stools become narrower than usual. This narrowing can be a red flag that shouldn't be ignored. But why do these changes happen? When tumors grow in the colon or rectum, they can affect how waste moves through your body. It's like a traffic jam in your digestive system. Things just don't flow as they should. Occasional changes in your bowel habits are normal and can happen for many reasons. But if you notice changes that last for more than a few weeks, it's time to talk to your doctor. Dr. Richard C. Wender, a cancer expert, says, "Blood in a bowel movement is never normal, so get it checked out. If you notice blood in your stool, which might look dark red or black, it's time to see a doctor. These could be signs that something more serious is going on. By paying attention to these signs and getting checked when something seems off, you're taking an important step in protecting your health. Your body is trying to communicate with you, and sometimes that communication happens in unexpected ways." Moving from one part of the body to another, let's talk about a cancer sign that's often hiding in plain sight. Number 7 is all about breast changes that aren't lumps. Many women think that if they can't feel a lump, everything's fine. But your breasts can give you other important clues about your health. Let's start with skin changes. If you notice any puckering, dimpling, or changes in the texture of your breast skin, pay attention. These could be signs that something's not right under the surface. Now let's talk about your nipples. If your nipple starts to turn inward when it didn't before, or if you see any discharge, especially if it's bloody and you're not breastfeeding, don't ignore it. Why do these changes matter? Cancer can affect how your breast tissue grows and behaves. This can lead to changes you can see or feel even before a lump forms. Dr. Wender says, Those signs don't necessarily mean it's cancer, but that's exactly why women delay seeking help, because they're hoping it's nothing. So how can you stay on top of these changes? Do regular self-exams so you know what's normal for you. This way you'll notice if something changes. And don't skip your regular checkups and mammograms. These screenings can catch things you might miss on your own. What should you do if you notice any of these changes? Make an appointment with your doctor to get things checked out. They can help figure out what's going on and whether you need more tests. As we continue our countdown of cancer signs, we arrive at number 6, skin signals. Your skin, the body's largest organ, can tell a story about your health. It's not just about protecting you from the outside world. It's also a canvas that can display important warning signs. Have you ever noticed changes in your moles? It's easy to think that all moles are the same, but that's not true. Moles that change in size, color, or shape can be signs of skin cancer, but it's not just about moles. Any sores on your skin that don't heal or keep bleeding could also be warning signs. Your skin is tough, but when it can't heal itself, that's a red flag. Now let's talk about a handy tool you can use to check your moles. It's called the ABCDE method. This isn't a complex medical test, it's something you can do at home. For more information on how to do the ABCDE method and other common cancers, check out our video on why these 5 cancers are on the rise. It's always better to be safe and get the changes in your skin checked out. Your doctor can help figure out if there's anything to worry about. So take a good look at your moles and marks regularly. If you notice any changes or new spots, make a note and show your doctor at your next checkup. Number 5 on our countdown brings us to a part of your body you might not think about often: your lymph nodes. Your body has a network of tiny bean-shaped structures called lymph nodes. They're part of your immune system and help fight infections. But sometimes, these silent guardians can become bearers of alarming news. Normally, lymph nodes are soft and movable. You might feel them when you have a cold or flu. But if you notice a lymph node that feels hard or rubbery and doesn't move easily, this could be a sign of something more serious, like cancer. Where should you check? The neck, underarms, and groin are common areas where swollen lymph nodes might appear. If you feel swelling in these areas that doesn't go away after a few weeks, it's important to see your doctor. Dr. Elwin Kabebe, a cancer expert, says, if symptoms are out of the ordinary, persistent, or extreme in intensity, they should be reported to a healthcare provider. This advice is crucial when it comes to lymph node changes, but how can you tell if a swollen lymph node is just fighting an infection or if it might be cancer? Here are some clues. 1. Duration. Swelling lasts more than 2 or 3 weeks. 2. Size. Cancerous lymph nodes often grow larger over time. 3. Pain. While both infected and cancerous lymph nodes can be painful, cancer-related swelling is often painless. 4. Other symptoms. If you have a fever or night sweats along with swollen lymph nodes, see your doctor. Many times your lymph nodes are just doing their job fighting off infections, but it's important to know when swelling might be a sign of something more serious. Don't ignore persistent swelling or changes in your lymph nodes. Your body might be trying to tell you something important. Now that we've explored the hidden messages in your lymph nodes, let's turn our attention to a different kind of swelling. At number 4, we have bloating. Many women brush off a bloated feeling as just a sign of a big meal or stress. But ongoing bloating could be your body trying to give you a warning. Bloating that lasts for more than 2 weeks, especially when it comes with other signs like pain in your pelvic area, could be pointing to ovarian cancer. This type of cancer is often called the silent killer because its signs can be hard to spot. That's why it's so important to pay attention to changes in your body, even ones that might seem small. Dr. Wender says, if it's been a few weeks and isn't getting better, that's a change. That's not you. Ask a doctor to take a closer look. This advice is key when it comes to persistent bloating. Bloating can happen for many reasons. It could be from eating certain foods, or it might be linked to other health issues like irritable bowel syndrome. So, how can you tell if your bloating might be serious? Here are some things to look out for. 1. If the bloating lasts for more than 2 weeks. 2. If you feel pain in your pelvic area along with the bloating. 3. If you feel full quickly when eating normal-sized meals. 4. If you're peeing more often than usual. Don't make the mistake of ignoring ongoing bloating or thinking it's just part of getting older. Your body has ways of telling you when something's not right, and sometimes those signals come from your belly. Number 3 on our countdown is unusual bleeding. This isn't just about a minor cut or scrape. We're talking about bleeding that shouldn't happen, especially for women who have gone through menopause. If you've stopped having periods for a year or more and suddenly see blood, this could be a sign of cancer. It's easy to brush off as just a weird body thing, but it's really important to get it checked out. Why is this so crucial? Well, catching cancer early can make a big difference. The American Cancer Society says that when uterine cancer is found early, the 5-year survival rate is 96%. That's really good news, but only if you catch it in time. Dr. Maury Markman, a cancer expert, says, any type of postmenopausal bleeding should be evaluated immediately. It may not be anything major, but it could also be an early warning sign of uterine cancer. But it's not just about bleeding after menopause. There are other types of unusual bleeding to watch out for too. If you see blood in your pee, that's also something to talk to your doctor about. It could be a sign of other types of cancer, like bladder cancer. Now, don't panic if you notice these things. Not all unusual bleeding means cancer, but it's always better to be safe and get it checked out. Your doctor can help figure out what's going on and make sure you're okay. Nearing the top of our list, we have persistent cough. A persistent cough could be more than just an annoyance. It might be a warning sign you can't afford to ignore. We've all had coughs, and usually they're no big deal. But when a cough sticks around for more than 3 weeks, it could be a sign of lung cancer, especially if you're coughing up blood. Now, you don't have to worry immediately if you've had a cough for a while. There are many reasons for coughs that aren't cancer, but it's important to know when a cough might be something more serious. You might be thinking, but I don't smoke, so I don't need to worry about lung cancer. That's not true. While smoking does increase your risk, non-smokers can get lung cancer too. Dr. Maury Markman, a cancer expert, says, if it's different than your regular cough and if it persists or you cough up a little blood, that's significant. There are also other things that can cause a long-lasting cough. It could be bronchitis, asthma, or even acid reflux. Sometimes medications for high blood pressure, like an ACE inhibitor drug, can cause a cough too. But if your cough doesn't get better with treatment for these conditions, it's time to look deeper. Don't ignore a cough that won't go away. Sometimes symptoms of a serious disease may be a form of a cough that just won't quit. Finally, at number 1 on our list are fatigue and weakness. Feeling tired is normal, right? We all have those days when we just want to stay in bed. But what if your tiredness is more than just needing a good night's sleep? Persistent fatigue and weakness can be early signs of leukemia and colon cancer. But how can you tell the difference between normal tiredness and the kind that might mean something more serious? Normal tiredness usually gets better with rest. But cancer-related fatigue doesn't go away, even when you sleep. It's a deep, whole-body exhaustion that can make everyday tasks feel impossible. Dr. Wender says, if you notice you're tired every day for more than a month, or experience shortness of breath when you didn't before, see a doctor. Why does cancer cause fatigue? There are a few reasons. Cancer cells can release proteins that make you feel tired. Also, some cancers, like colon and stomach cancer, can cause bleeding inside your body. This can lead to anemia, which means you don't have enough healthy red blood cells to carry oxygen around your body. That's why you might feel weak and tired all the time. Usually, feeling fatigued could be from stress, poor sleep, or other health issues. But if it's affecting your daily life, then that is a different story. Remember, your body knows when something's not right. If you're feeling unusually tired for more than a month, don't brush it off. Talk to your doctor. They can help figure out what's causing your fatigue and make sure you get the right care. And there you have it. 9 alarming cancer signs women often ignore. Be proactive about your health. If you notice any of the signs we've talked about, whether big or small, or if something just doesn't feel right, consult your doctor. Regular screenings and self-checks are important too. They can help catch problems early, when they're easier to treat. Your body speaks to you every day. Listen to its signals, try to understand what they mean, and take action when you need to, because your health is in your hands. We'd love to hear from you. Which of these signs surprised you the most? Do you have any advice for women on staying aware of their health? Share your tips and insights in the comments below. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the bell icon to stay updated with our latest health tips. And if this video has been valuable to you, consider sending us a super thanks. It's a wonderful way to support our channel and help us continue making informative content. Also, don't forget to check out our merchandise for some cool stuff. Thank you for watching, and here's to your health.